A groundbreaking innovation is leveraging digital tools to identify zero-dose children who have not been vaccinated, tracking their location, identity, and reason for not being vaccinated. According to Dr. Bianca Van Cleef, this innovation will not only identify children who have not been vaccinated, but also monitor progress.
So digitalization gives us that leverage on identifying who they are, where they are, and why they are zero-dose. For example, a child happens to live in a community, in a context. In that community, there are schools. The child might not be vaccinated, but that child go to school. So digitalizations help us to bridge that gap. How can the school system capture this child and notice that this child is not vaccinated and link to the vaccination service?
Armed conflict has severely impacted immunization efforts in Cameroon, leaving many children unvaccinated. The community-based tracking for immunization project addresses these challenges through community-based tracking and digitalization.
Conflict that has affected the northwest and southwest, and also far north, the Boko Haram obviously, and also the rise of urban settlements, of urban slums in littoral, that has really have an impact on our immunization coverage, which is there are more communities that are mixed, communities that are not vaccinated, leading to high number of zero-dose children and high number of children that are under-immunized. So this project comes in a very critical moment where we as stakeholders in the immunization landscape are struggling to concert efforts to see how we improve immunization coverage in Cameroon.
The Limbe workshop brought together participants from Cameroon, Nigeria, Madagascar, and Bangladesh. Dr. Chinzoba Wonodi emphasized on the key role civil society organizations play in documenting community-based activities to address data gap, coordination, and local resource mobilization, which are essential for improving immunization coverage.
Destroy an immunization program, right? Where can we find information about rumors that are circulating in a community?
Dr. Nizam from Bangladesh shared insight on immunization success, highlighting that despite achieving 84% success over 15 years, there is need for stakeholders to change their strategies by collaborating more with government officials and community-based civil society organizations. Emphasizing on the importance of digitalization and immunization, citing its effectiveness in Bangladesh.
Bangladesh is doing good actually. Over the last 15 years, Bangladesh remained 84% full immunization coverage. And primary access to vaccination is over 99%. And so that in that perspective is doing good. But what we are challenging to us, that we are achieving 85% over the last 20 years, we are not achieving next 15% in the last 20 years. So that means we need to change our strategy.
The Combat Project marks a significant step in strengthening immunization system by harnessing digitalization and community-based tracking. The project aims to improve immunization coverage and protect vulnerable children.